Good afternoon, good evening, good morning to you, wherever you're tuning in from. Welcome to the very first of our 2025 Veterinary Neurology Live Journal Club webinars. If you've not joined us before, then shame on you. But this is where we invite an up-and-coming star in the profession to review a recent publication on their research. Where you can ask questions during the session, which we'll relay to our speaker at the end of their presentation. Today's webinar is sponsored by Hallmark Veterinary Imaging, and our speaker today is Dr. Cecilia-Gabrilla Danciu. I hope I've got that right. Anyway, let's dive right in with an introduction for Cecilia, so that you can get to know her. Cecilia graduated from the Faculty of Veterinary Medicine in Cluj-Napoca, Romania in 2017, and Cecilia then completed a PhD diploma at her alma mater. In 2020, Cecilia moved to the UK to undertake a neurology specialty internship at the Ralph Veterinary Referral Centre. So hi from us to everyone at the Ralph. Following the neurology internship, Cecilia started her ECVN residency in veterinary neurology and neurosurgery at the Queen Mother Hospital for Animals at the Royal Veterinary College in London. So hi to everyone there. And she completed that in July 2024. Cecilia is currently a clinician and a lecturer at the University of Liverpool's Neurology Service. We know them well. Hi to everyone there. Her research interests span various areas of veterinary neurology, with a particular focus on stroke, vestibular disease, and spinal injury. Today, Cecilia is going to be talking about her recent publication on comorbidities, long-term outcome, and post-stroke epilepsy associated with ischemic stroke in 125 dogs. So welcome, Cecilia. Thanks very much for giving up your time to talk about your research, and congratulations on the publication. I'm going to hand over to you so that we can hear all about it. Thank you very much.
Thank you. I just want to double check that you guys can hear me.
Yep.
Perfect. Thank you for the kind presentation. So I will be starting now. So just as a little bit of background, we know that ischemic stroke is defined as neurological deficit secondary to focal ischemic injury involving a defined vascular territory of the brain. And based on previous literature, we know that dogs that suffer an ischemic stroke, in approximately 54%, they have a comorbidity, with the most common one being hyperadrenocorticism and chronic kidney disease. In terms of prognosis, and again based on previous literature, we know that dogs tend to do well. However, those ones that have a comorbidity tend to have a shorter survival time, and also approximately 30% of them will have a recurrence of the neurological signs after the diagnosis of the ischemic stroke. However, more favorable short-term outcome was reported in those dogs that suffer a rostral cerebellar artery ischemic stroke. In terms of post-stroke epilepsy, this is a very well-described phenomenon in humans. In terms of veterinary literature, we know that epileptic seizures can be part of the acute presentation in up to 59% of the dogs, and these were not associated with outcome. And also epileptic seizures or epilepsy following the diagnosis of ischemic stroke was reported previously in up to 20% of the cases. However, there is limited veterinary literature specifically evaluating the occurrence of post-stroke epilepsy in dogs. Having this background, we had a couple of objectives in our study. Firstly, to describe the comorbidities and also the ischemic stroke location and extent, and then also to look for association between these variables and long-term outcome, including survival, stroke recurrence, and development of post-stroke epileptic seizures. So this was a retrospective multi-center observational study for which we had ethical approval from the Royal Veterinary College Ethical Board. We had also participating institutions including University of Liverpool, Pride Veterinary Referral Centre, and the University of Copenhagen. We included those dogs who had an acute or peracute onset of non-progressive neurological signs, which had a neuroanatomical localization to the brain. These dogs had to have an MRI scan of their brain, and they had to have a diagnosis of ischemic stroke based on previously published criteria. These dogs had to have a minimum of blood work and also urine analysis, and were indicated hormonal testing and also non-invasive blood pressure measurement. If they had a concurrent brain pathology, which was identified on the MRI, or if they had a previous history of ischemic stroke, or if the stroke had a hemorrhagic component, or if they had a previous history of epileptic seizures, or if their records were incomplete, they were excluded from the study. In terms of short-term follow-up, we looked if they survived the discharge and also how long they spent in the hospital. In terms of long-term follow-up, we contacted referring veterinarians, and then for those dogs that were reported to be alive at the time of the follow-up, we also contacted owners, and then we requested them to complete a quality of life questionnaire. We specifically looked at information involving survival time, development of post-stroke epileptic seizures or epilepsy, and also recurrence of ischemic stroke. The outcome was defined as excellent if they made a full recovery, good if they had a marked neurological improvement with some impairment remaining, and poor if they did not make a functional recovery or if they suffered a stroke recurrence. All this data was statistically analyzed. In terms of the results, 125 dogs met the inclusion criteria, of which 55 were female, 70 were male. The median age was 9 years with a median body weight 17 kilograms, and the most commonly presenting breeds were Greyhound, Crossbreed, Cavalier King Charles Spaniel, Shih Tzu, and English Springer Spaniel. And here I will invite you to look in the paper on the publication for the rest of the breeds which were also presented in this study. 11 of these dogs had an epileptic seizure as a primary presenting sign. 39 of the total number of dogs were non-ambulatory on presentation. And when we looked at the neuroanatomical localization, the most common one was to the cerebellum in 48 dogs, then followed by forebrain in 35 dogs, vestibular system in 21, and then in a smaller number, it was multifocal or brainstem. After this dog had an MRI scan, we also looked at the location of the ischemic stroke, and the most common one was again to the cerebellum in 67 dogs, followed by the thalamus in 24 dogs, cerebral hemispheres in 20 dogs, and then in smaller number again brainstem or multifocal ischemic strokes. 72 of these dogs had a territorial ischemic stroke, and 53 had a lacunar ischemic stroke. Pre-existing comorbidities were described in 9 of these dogs, including pre-existing cardiac murmur, mitral valve disease, proteinuria, chronic kidney disease, hyperadrenocorticism, or well-controlled steroid-responsive meningitis arteritis. Following investigations, newly diagnosed comorbidities were reported in 49 dogs, that making a total of 52 dogs having comorbidities in this cohort. The most common one was hypertension, again proteinuria, and also we had a large number of dogs having cardiac disease, and then in smaller numbers, chronic kidney disease, neoplasia, hypercoagulable state, hypothyroidism, and hyperadrenocorticism. In the group of dogs with ischemic stroke with a comorbidity reported, there were 21 female dogs and 31 male. The median age in this group was 10 years, and the median body weight was 19 kilograms. In the group of dogs with an ischemic stroke but without an identifiable comorbidity, there were 42 females and 31 males. The median age in this group was close to 9 years, and the median body weight was 17 kilograms. And we found no significant association between comorbidities and age, breed, sex, or weight. And we found no association between comorbidities and location or extent of the ischemic stroke. When we looked at the short-term follow-up, we found that the median days of hospitalization for both groups, including dogs with a comorbidity or without a comorbidity, it was 2 days. And equally, 4 dogs did not survive the discharge in both groups. The reason of the death or euthanasia was also recorded, and in 4 dogs, they were euthanized because of the severity of the comorbidities. 2 dogs were euthanized because perceived neurological worsening. 1 dog was euthanized because lack of neurological improvement, and 1 dog suffered cardiopulmonary arrest. In terms of the location of the ischemic stroke, for those dogs that did not survive the discharge, in 4 of them, it was in the forebrain, in 2 of them in the cerebellum, and in 2 dogs, we found them in forebrain and cerebellum. The extent of the ischemic stroke was territorial in all 8, and 4 of them were non-ambulatory on presentation. In these dogs, we found no association between survival to discharge and non-ambulatory status on presentation or a comorbidity. We found that territorial ischemic stroke was associated with non-survival to discharge, whilst dogs with a cerebellar location of ischemic stroke were significantly more likely to survive to discharge. In terms of long-term follow-up, we found that 29 dogs were alive, 84 dogs were reported to be dead, and 4 dogs were lost to follow-up at that time. In terms of those 29 dogs that were alive, the median follow-up time was 906 days, and the quality of life questionnaire was completed by 13 owners. They reported excellent outcome in 8 of them, good in 2 of them, and poor in 3 of these dogs. In terms of the dogs that were reported dead at the time of the follow-up, the causes were mainly related to suspected ischemic stroke in 16, and this led to euthanasia. Unrelated reasons for that were reported in 49 dogs, and unknown cause of death was reported in 17 dogs. The median survival time for dogs with a comorbidity was shorter in comparison with the dogs having no comorbidity, so 482 days versus 907 days. But when we looked at the survival curve, and we can see here on the right-hand side a Kaplan-Meier survival curve, we found no significant difference between the survival of dogs with or without a comorbidity. We also looked at other variables such as comorbidity of hypertension or proteinuria or cardiac disease, or also looking at dogs being ambulatory or non-ambulatory on presentation in terms of their extent of ischemic stroke or location of the ischemic stroke. And again, when we looked at the graphs, we found that there was no significant association found in dogs surviving basically between these groups. In terms of ischemic stroke recurrence, this was suspected in 22 dogs. It means that these dogs had no repeat MRI scan. Of these dogs, 9 of them had a comorbidity, and the ischemic stroke was confirmed in 2 dogs, and only 1 of them had a comorbidity. 7 of these dogs had a cardiac disease recorded as well. In terms of median time for stroke recurrence, this was 453 days, and we found no significant association between comorbidities and the likelihood of having an ischemic stroke recurrence. And we also found no significant association between the recurrence of the ischemic stroke and concurrent cardiac disease. Median survival time for dogs with stroke recurrence was 869 days, and for those dogs that had no recurrence, it was 641 days. Again, when we looked at the Kaplan-Meier survival curve, we found no significant difference regarding long-term survival between dogs with or without stroke recurrence. In terms of outcome, 33 dogs had an excellent outcome, 7 of them had a good outcome, and 35 dogs had poor outcome, 8 of them died before the discharge, 6 of them were euthanized shortly after the discharge because insufficient functional recovery, and 21 of them had suspected or confirmed stroke recurrence. 17 of the dogs had an unknown outcome. In terms of epileptic seizures, of the 11 dogs that presented with epileptic seizures as a primary complaint, only 1 developed epilepsy after the discharge. 7 dogs that had no epilepsy at the time of the presentation developed later on post-stroke epilepsy. In terms of the epilepsy phenotype, 6 dogs had generalized seizures and 2 of them had focal seizures. The frequency of the epileptic seizures varied at each dog, and these are described in the study. Anti-seizure medication was administered in 3, including levetiracetam in 2 dogs, and the combination of levetiracetam and gabapentin in 1 dog. None of these dogs had a repeat MRI after they were found to have seizures. Location of the ischemic stroke in dogs with post-stroke epilepsy was found in the cerebral hemispheres in 3 dogs, in the cerebellum in 3 dogs, and in the thalamus in 2 dogs. The extent of the ischemic stroke was territorial in 5 of them and lacunar in 3. And again, we found no significant association between the development of post-stroke epilepsy and the location or extent of ischemic stroke at initial diagnosis. When we looked at the survival, again, we found no significant difference between dogs who had epileptic seizures as a presenting complaint and also in dogs who presented or developed post-stroke epilepsy compared to those without. Obviously, this study has some limitations. First of all, due to its retrospective nature. And also it is possible that some dogs during their acute presentation might have been incorrectly recognized as having epileptic seizures. There was also a lack of standardized diagnostic protocol between the institutions. The outcome measures or the follow-up are subject to recall bias, and the outcome was not available for the entire cohort of dogs. So it is possible that some of them might have been doing really well and some of them unfortunately not. And we also had a small number of post-mortem examinations, which is understandable considering that most of the dogs did well after the diagnosis. In terms of conclusion and clinical importance of this study, it is important to remember that comorbidities were reported in 41% of dogs diagnosed with ischemic stroke, with the most common comorbidities being hypertension, proteinuria, and cardiac disease. Cerebellar location of the ischemic stroke was associated with survival to discharge, and we found no significant difference in survival in dogs with ischemic stroke with or without comorbidities. However, it is possible that the study numbers were too low to detect a difference statistically. Despite no significant difference in survival, we would still recommend to investigate further in case there is an underlying disease, a comorbidity detected, to be able to give appropriate treatment. Presumed stroke recurrence was reported in 19% of dogs, with no significant association between diagnosis of comorbidities and long-term outcome. Poststroke epilepsy was uncommon and had no impact on survival. So overall, the outcome in these dogs is considered favorable. Obviously, this study wouldn't have been possible without the contribution of multiple amazing neurologists. So I would like to thank them with this occasion. And also for all the vets who took their time over the phone to give us a follow-up information, and also for the owners who completed the quality of life questionnaire. I would like to thank you, and if anyone wants to have a read, this is a QR code which is actually linked to the paper, and I'm happy to take any questions.
Thank you very much, Cecilia, for this very good presentation. We have a few questions. The first one is from Alexander. Alexander is asking if there's any idea why greyhound are overrepresented in this study.
Yes, so we haven't looked specifically into this aspect when we conducted the study, but we know that based on previous studies, they might be predisposed because sometimes they have a higher blood pressure, but this particular aspect was not investigated in our study.
Another thing I will just add is when you look at the aortic thrombus in dog, greyhound were also overrepresented as well, and obviously pose the question of whether or not it's got anything to do with being having any form of hypercoagulability, syndrome related to the breed as well. Another question as well from Marcelo. Excellent presentation. How do you explain seizures in dog with cerebellum ischemic stroke? I'm not sure if you mentioned that wrong.
Yes, so that's a very good question, because this was also one of our questions when we looked through the data. I would say that it is probably due to its retrospective nature, because obviously we could only describe whatever was reported in the medical records, and we described in our discussion part in the study that it is possible that some of the acute presentations might have been misinterpreted as epileptic seizures, and equally these dogs had no repeat MRI scan, so it is possible by having a new presentation or a new episode, it could have been basically a recurrence of ischemic stroke potentially to the forebrain. I hope that would make sense.
And quite a few of dogs presented with rostral cerebellar infarct. Very often, when you read the history, they will say the dog had a seizures. Yeah. And I think you're right. It's probably misinterpretation of the sign because of the location of the cerebellar infarct. They tend to go in opisthotronous. Because it happens suddenly, they will paddle. And I think, the owner or sometimes the referring vet may quickly conclude it's an epileptic seizures. And then you look at the MRI and there is a rostral cerebellar infarct. So it may be, an explanation, and nothing to do with the forebrain. So if you have any other question, please, we're going to probably wait another 2 or 3 minutes to see if anyone else wants to ask any question. I agree with you. It's a shame that some of these dogs with seizures didn't have any repeat MRI. In human, there is a clear, fairly clear link between ischemic stroke and glioma. So glioma can cause ischemic stroke, but also ischemic stroke can cause glioma. And there are some, nice paper of de novo glioma in the territory of a previous infarct. And only a few months ago, we're really lucky to document that on the dog. We haven't, published yet because we're waiting, for definitive diagnosis, but we've done repeated MRI where, the dog had a beautiful middle cerebral artery infarct. And then 6 months later, the dog started to develop a space-occupying lesion within the lesion itself. And we're monitoring that dog at the moment. So we don't know if it's a glioma, but it shows that repeating the MRI, I think, is important in this case, because maybe we'll see, like seen in human, this kind of de novo glioma within a territory of an infarct. We don't have any more questions, so I will leave the last word to Simon, but thanks a lot, Cecilia, for this great presentation.
Yeah, thank you very much. That was an excellent presentation. We really appreciate you giving up your time and talking about that study. Really helpful. So thank you very much for that. Thanks again to Hallmark Imaging for sponsoring, and thanks for all of you for attending. This presentation has been recorded and will be available on the Facebook site and our website, which is web-vetneurology.com, and as a podcast. Unfortunately, those of you listening on the podcast will have missed Dr. Garos's imitation of a seizure with the flailing around, which was very helpful to me. So anyway, hopefully we'll see something similar in the next session, and our next session is back next month, in fact, so in March. And then until then, stay safe, enjoy neurology. Goodbye.
Goodbye.
Goodbye.